The Federal Medical Center FMCEB Meta, established in 1964, began as the Department of Health Services under the Nigerian Railway Corporation (NRC). Initially, it served solely to meet the health care needs of NRC staff and their families. During the Nigerian Civil War, the center expanded its role, becoming an annex of the Lagos University Teaching Hospital to treat wounded soldiers. In 2004, the Federal Executive Council approved the transformation of the Nigerian Railway Hospital into a federal medical center. By 2005, it was officially handed over to the Federal Ministry of Health as a tertiary health care institution, officially named FMCEB Meta, Lagos. However, by July 2017, the center was struggling with multiple challenges, including disorganized medical and financial records, frequent power cuts, inadequate X-ray services, and equipment breakdown.
Generally, in the past 7 years, both clients and patients of the hospital would have noticed a lot of differences. New departments have arisen, like the cardiothoracic department, like oncology that treats cancer. These were departments that didn't exist before.
The face of pharmacy has actually improved drastically from where it was before to where it is now. This has actually helped to boost the morale of the staff. A good working condition, conducive for service delivery. Even the patient can attest to this.
I was not able to walk when I came in this morning, but by the grace of God, I was able to walk before leaving the hospital. I came in with that wheelchair, but I'm going on this other thing when I'm going home. But I can stand up on my own now. I could not stand when I was coming to the hospital today. The physiotherapy clinic has been very, very effective. So as the other clinics that I've attended.
The Department of Internal Medicine in the last 7 years has moved from a 3-unit department to an 8-unit department. Initially, we had the endo, cardio, and respiratory units, but now we have cardio, endo, dermatology, respiratory, gastroenterology, nephrology, neurology units.
These issues led to a serious loss of revenue, negatively affecting patients' care.
We have gone from occupying a small space that housed a few beds and also housed the newborn units to getting a complete building, a 2-story building that houses the clinic on the ground floor, the wards, the pediatric wards on the first floor, and then the pediatric surgical floor and a pediatric intensive care unit on the second floor. The transformation in the last 7 years has been really amazing. We also have a children's emergency unit.
You know, the very first day I came, I am not a stranger to the institution, so I actually knew what the institution was like. Okay, but when I resumed, and I then had the opportunity to have a close look, okay, and a more detailed look on the operations and services, okay, and processes of the hospital, it became pretty clear to me that, in my own opinion at that time, that we could punch, you know, a lot higher than we were doing, okay, and that we actually need to, you know, do a reform process that would ensure that the hospital is able to deliver the kind of care that it was set up to deliver, which is as a tertiary hospital. There were quite a number of challenges at that time. Those challenges were not any different from the challenges that were afflicting many of the government hospitals at that time. You had things like service failure, okay. You had poor quality of service delivery. You had inadequate infrastructure and support system, okay, and almost totally absent technological investment to, to ensure good service delivery, okay, and then of course challenges in the accounting system. The workers were quite poorly motivated. Disciplinary issues were very common, okay, and a host of other problems. The first major thing we needed to do at that time was to actually motivate the workers, train them, okay, enhance their capacity, okay, and ensure that they are able to deliver the kind of services that we expect a tertiary hospital to deliver. So that involved a lot of training, okay, that involved a lot of trying to gain their confidence. We needed to, target commitment of workers, okay. Commitment means that even if the MD does not say it and the worker thinks from his training that it should be done, he will do it, and he will do it over and over and over again.
We conduct a promotion interview right from 2017 to date within the first quarter of the year. By so doing, we contribute in motivating the staff in terms of their progression and personnel professional progression in their different fields.
After 8 years of decline, FMCEB Meta has undergone a remarkable transformation, rising from its past struggles to regain its reputation.
That was what led us to now create our plan of action, which was like a strategic plan, okay, which was based majorly on 5 pillars, okay. The first pillar, like I said, had to do with motivating the workers, enhancing their capacity to work, okay. The second one had to do with improving the quality of services and care that we're offering to Nigerians, okay. The third one was the need for us to actually expand the scope of our services and the scope of our infrastructure, all right. The fourth one was to ensure that there was good financial management and partnership with those who were willing to actually support, to support us in our journey, okay. And then of course the last one is the use of technology to improve the quality of care that Nigerians were having.
In FMCEB Meta, anybody that comes in to deliver goes home with her baby, either 1 or 2. We deliver the IVF cases. I have delivered 4, that is quadruplet, in this hospital before, and they are all doing fine. We do the IVF cases. Most of the patients that comes in here, they undergo surgeries, and both mother and babies are doing well.
I'll tell you, when patients come to our hospital and for one reason or the other we had to refer them out, they're usually not happy, not just because of the infrastructure we have, but also because of the attitude of our staff to work. Our staff are dedicated, they are committed. We hear stories in other institutions where when you want to come in, you probably have to know somebody to be able to access services. That is not the case here. Anybody can walk into our hospital and they are sure to receive quality care. One of the other things we also do is that when patients come into our accident and emergency, for example, without a dime, within the first 24 to 48 hours, we really don't collect any money for them. We treat them and at no cost to them within the first 24 to 48 hours, because for us, saving life is much, much important.
We have the electronic check-in system whereby when every staff is expected to clock in and clock out, and there is a staff to monitoring that in human resource section of administration.